Hello, my name is Brian Day, and my how-to EMS video this week is on administering a CPAP. I'm basically just going to talk about what a CPAP is, some of the features of it, and some of the uses for it, and basically why we do use CPAP, why we administer it, and then I'm going to show you how to put it on. CPAP basically stands for continuous airway pressure. It's a device that is basically, it's going to use a mild pressure to mild positive pressure to force air down into your lungs, to force your airway to open up more, allow you to breathe a little bit better. Machine can be prescribed to you from a doctor or given to you from a doctor for a couple of reasons. One is, somebody might have sleep apnea, has trouble breathing at night while they're sleeping, or they snore, or they have some kind of airway blockage while they're sleeping. This will help force their airway open and allow them to get adequate oxygen throughout the evening or during the day if you're sleeping. For emergency uses, we use the CPAP kind of in the same way, but it's an emergency to basically save somebody's life or keep them from circling the drain, meaning that they might be having trouble breathing, and if we don't get that CPAP on them, that continuous positive airway pressure, that they could eventually stop breathing or be in more distress than they are when they call 911. Basically what we're doing is we're increasing that airflow down into their lungs to open up those airways, and in doing so we hope that we not only open up their airways, but we increase the amount of O2 that's being delivered to them. Some of the reasons for applying CPAP, or for patients that might have congestive heart failure, or as we call CHF. Congestive heart failure is basically if you think of your heart as your pump doesn't work adequately. It doesn't pump the blood throughout your system the way it's supposed to, and you end up getting a fluid buildup or blood that's kind of left behind in the system. One of the things a lot of us paramedics look for is edema in the lower extremities, meaning your feet or your lower legs, where you'll see swelling of the feet or the lower ankles, or lower legs and ankles. And when you actually push with your finger on somebody's lower extremity, you can get what they call pitting, where you leave like a small indentation. That means there's a fluid buildup there, and that's usually indicative of somebody having congestive heart failure. So what we'll do is we'll give them that CPAP, and it'll make them, it'll kind of work well with the heart to help pump that fluid the way it's supposed to, and it'll prevent that backup into the lungs, which I'll talk about is basically pulmonary edema, or known as PE. Pulmonary edema is basically just that. It's your lungs getting filled with fluid, and it can be from heart failure. And what ends up happening is that fluid or that blood that gets transferred over to your lungs to get oxygenated and sent back out to the rest of your body, out to the vital organs and to the end tissues. It starts to coagulate, and it starts to stay within the lungs, and you start to get a fluid buildup. Now, what ends up happening is at night, if we go back to that doctor giving you the giving you the CPAP at night, is if you picture somebody standing up and they get that fluid in their lungs. Let's just say it's down at the base of their lungs. Well, most of their lungs are still functional. Now you lay that person down, and what ends up happening is that fluid gets dispersed throughout the lungs, and it's covering a lot more lung tissue, making it harder to breathe. So that CPAP will help force that air in and eventually force that fluid out of the lungs and into other tissues, allowing you to breathe better. So that's the main two uses of our CPAP. It's also used for asthmatic patients too, to help them breathe better. While the CPAP is forcing air out of your lungs and helping you breathe better, There's some other things that we can administer, like medications that might be prescribed from a doctor or medications that we might give. So it's nice. I have a CPAP here. I'm going to kind of show you, see if I can put it in the video here. This is one of the masks that we have. It's got this device. You're going to connect it here. In between here, we can put, I don't have it with me, but you could put a container that you can put medication in, so somebody who's breathing in the air can also breathe in that medication. For instance, you can use albuterol, Atrovan, or if you want to use like a normal saline, for instance, to help get some fluid down in there if they need that. You have your airline hose here. Back up a little bit. Your airline hose here, which will connect, give them oxygen. I'm not going to go over it, but there's different settings that you can use, and there's a little cheat sheet on here to help create the right airflow for your patient. When you're applying the CPAP, you've got these nice little clicks here on the side. You can unclip those, or you can just stretch it around the person's head and put it on. I'll just show you how to put it on real quick, and that'll end the video. It's important when you're putting this on that you get a proper seal all the way around. If you don't get a proper seal, then that air is not going to be forced in the way it's supposed to. So after you put it on, you kind of want to feel around, make sure there's no excess air coming on the outside. This is how you put it on. And that's how you put on your CPAP. You want to make sure you have a proper seal all the way around, and it's going to force that air into the nose, and then through the mouth and down into the lungs. Alright, that's your CPAP. Thank you.